Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Now we'll continue with oral hypoglycemic drugs. Under oral hypoglycemic drugs, we'll look at the overcome the insulin resistance. And we will look at part 1. Part 1 will be covering the bigonides, the thiazolidine, as well as the alpha glucosidase inhibitors. So first is bigonides. So what is bigonides? Bigonides is nothing but AMP. Bigonides is AMP activated protein kinase. So it's the AMP activated protein kinase activator, and the example is metformin. So mechanism of bigonides is that it decreases the hepatic gluconeogenesis, and it increases. So it decreases the hepatic gluconeogenesis, and it increases the glycolysis. Next is there's increase in the insulin activity, and there is a decrease in the insulin resistance. There is a decrease in the hyperlipidemia. So what is the adverse effects of the bigonides? Adverse effects is that it can lead to the lactic acidosis. There can be diarrhea. There can be metallic taste. There can be decrease in the vitamin B12 decrease, and there can be a contraindicator in case of the hepatic as well as renal insufficiency. Next we move on to the thiazolidine. So thiazolidine is nothing but the peroxisome proliferative activator receptor. Is a peroxisome proliferator activator receptor. So this is nothing but the gamma activator. So the example is the pioglitazone. So here the mechanism is that it decreases the gluconeogenesis, and it increases the tissue uptake of glucose. Then it decreases the insulin resistance as well. So disadvantage of this thiazolidine is that it can result in weight gain. It can cause anemia. It can cause pedal edema. It can cause increase in the serum LDL, and there can be macular edema, hepatotoxicity, as well as it is very safe in case of the renal disease, and it is contraindicated in the liver disease. Next, moving on to the alpha glucosidase. The alpha glucosidase inhibitors. So this includes the acarbose, the miglytol, as well as the voglibose. So what happens here is this inhibits the intestinal brush border. So inhibits intestinal brush border alpha glucosidase, and what this result is, it decreases the intestinal glucose absorption. So decreases the intestinal glucose absorption. So the example here is the adverse effect will be they can cause flatulence, they can cause diarrhea, they can cause GI disturbances. To learn and grow daily like this, please do subscribe.